Yeah, I think obviously a lot of people are over the pandemic. We all want it to have stopped some time ago, but we can't wish it away. It is a reality. It's, as people say, it's an inconvenient truth like climate change.
How dare
we
you!
have to change the way we live to manage this threat. And I think the two basics are, if you're sick, don't go out. And that applies, that stops all viruses, all infections. And the other one is we have to turn into a mask-using society.
Just start with a bit of orientation to what's going on. These are cases, of course, per million.
Societies that have embraced mask use are doing very well, like Japan, South Korea.
South Korea and Japan? Well, these are cases, of course, per million. These are quite high, as is Taiwan, but Taiwan has come down, so Taiwan's kind of got over it. But Japan and South Korea are still going up.
Societies that have embraced mask use are doing very well, like Japan, South Korea.
Japan and South Korea are still going up.
Societies that have embraced mask use are doing very well.
To put the world to rights. I stay home forever, but two always makes a fight.
And when you look at the countries that are succeeding, they are mask-using societies. People have got the idea that on a summer's day you put on sunblock and a sun hat. When you get in a car you put on your safety belt. When you go to any indoor event you put on your mask, and you have a mandate to back that up.
There's no evidence that a mask mandate has worked. The people in the United States at a very high frequency have been wearing masks for months, and the cases exploded, whether it's in certain states like Hawaii, Minnesota. You know, you could look at all the data.
If you expected masks to be a panacea, you would have seen an enormous effect in cases all across the country. In fact, frankly, all across Europe as well. And we haven't seen that.
One of the benefits of masks is they stop you firing out these viral particles. And we know now that this virus is transmitted on these droplets and also aerosols that can actually go for many metres.
Epidemiologist Michael Baker says that masks must remain compulsory in schools if we are to move to the orange traffic light setting.
Children should not wear face masks, no. They don't need it for their own protection, and they don't need it for protecting other people either.
We need a mask mandate in schools immediately.
Mask wearing in children has no good scientific evidence in favor of it. Right? There is not a single randomized study still that demonstrates any efficacy of mask wearing in children
for either them getting the disease
or spreading it, right?
Doctors and scientists have been urging the government to make mask wearing in schools mandatory again, and a leaked email to Newsroom from last month revealed that even employees at the Ministry of Health, including the CEO, asked the COVID response minister, Chris Hipkins, to reintroduce the policy. Why the reticence? Epidemiologist Michael Baker is with us now. Michael, why the reticence?
Look, I don't know why. Like we have mandatory masking still on public transport and aircraft and so on, and we think we should surely take the same approach with schools.
Is there any evidence that those face masks are what are keeping children or their teachers safe?
No, there isn't at this moment in time evidence that masks in schools reduce the uncertainty about whether they work or not.
Michael, today you said we need more maskage, even as young as 2-year-olds you're recommending. Have you ever tried to put a mask on a 2-year-old?
No, I think it would be challenging. But one thing we've learned from talking with people from overseas, and this is a recommendation from the US CDC, this is standard practice there.
And in terms of masking children, it seems absolutely obvious that that is psychologically deeply damaging.
I think to get through winter, we need to reintroduce a mask mandate for our schools.
There's no scientific rationale or logic to have children wear masks in schools.
We need students and teachers to be wearing masks because unfortunately that's the only barrier we've got in many cases, because only 20% of students are fully vaccinated at the moment.
In Sweden there was no social distancing in the schools and there was no masks in the schools, and despite that it was perfectly safe for both children and teachers.
World Health Organization, one of the things it does pulls together expert committees and it concluded in June last year that masks were useful.
The World Health Organization committee that reviewed the evidence for the use of face coverings in public didn't back them, but after political lobbying, the WHO now recommends them.
And they're particularly useful as source control.
There's a whole range of randomized trials before the pandemic that looked at the efficacy of mask wearing on controlling the flu, and both source control and self protection, which found very disappointing results.
The CDC published a study reviewing all the data on influenza virus, which is a virus that has similar size to this virus. In May 2020, the CDC has that posted, where all the data on masks showed that it does not stop the spread of a viral infection.
And they're particularly useful as source control.
Any old piece of fabric, tuck something that's going to hold it on your ears, and you've got a mask that's going to protect you or people around you. Is that right?
Exactly, yeah. It's particularly to protect the people around you.
This source control argument is bogus. Source control means the person wearing the mask, somehow or other, those viruses can't escape the mask. That's just nonsense. If you've got this super freeway, the virus doesn't care where it's coming in or going out.
And they're particularly useful as source control.
A number of people have said Michael Baker has come out many times and said masks don't work. So I'm putting it to you again. Are masks effective in stopping the transmission, or at least mitigating the transmission of COVID-19 or the new variants?
Yes, and if anyone doubts the effectiveness of masks, just look at what healthcare workers use. They put on a good performing mask every day when they go to work. Many of them have gone for months or years without ever getting the virus, even though they're looking after sick people with COVID-19 every day.
We had a study around the mid of 2021 out of Ho Chi Minh City, Vietnam. All of the nurses in that study wore PPE, full masks, full visors, full gowns. They all became infected. It showed us clearly that PPE in a hospital setting doesn't work. That study, supported one by Shitrit in Israel, showed that the PPE in the hospital setting failed, and also nosocomial outbreak. It was supported by one by Hattimäki in Finland. Also showed us nurses' PPE, full masks, full gowns, fail. Does not prevent transmission.
If anyone doubts the effectiveness of masks, just look at what healthcare workers use.
So I was reading this article from Stuff. This is from February 10th, 2022, and it mentions Michael Baker here. Here he is. So it says, Baker referred to a study of 534 people published this week, which showed the risk of testing positive for COVID-19 was lowered while in indoor public places among those wearing cloth, surgical and respirator masks compared to those who wore none, by 56%, 66% and 83% respectively. So this is the study that Michael Baker is referring to. This is from the CDC. The study is titled Effectiveness of Face Mask or Respirator Use in Indoor Public Settings for Prevention of SARS-CoV-2 Infection, California, February to December 2021. So here's a graphic in the study, supposedly showing that if you wear a cloth mask, it reduces your chances of testing positive by 56%, if you wear a surgical mask by 66%, and if you wear a respirator by a whopping 83%. Impressive, huh? No wonder Michael Baker is saying things like this about face masks.
And they have the huge benefit that they really interrupt transmission very effectively.
And I'll give the link to this study in the description box. Okay, so let's take a look at what's being said about this study. So this is an article in Substack by Ian Miller. And Ian Miller is the author of this book, Unmasked, The Global Failure of COVID Mask Mandates. So I'm not going to read the whole article, that would take too long. But what I will do is read a little bit from the beginning of it and then a bit from the end of it, just to give you some idea. And I'll give the link to the article in the description box so you could read the whole thing. So starting with the title, the CDC's latest study on masks is purposeful misinformation. Then the article begins. Misinformation is one of the most overused terms in our modern world. Instead of referring to information that is purposefully misleading, it's now become an easy shorthand term for major media outlets when referring to information they don't like. But misinformation is real. There are people and officials and entire government agencies who disseminate information that is demonstrably incorrect in order to maintain their narrative or encourage compliance with their mandates. Unfortunately, this isn't a new phenomenon. At this point, most people have come to realise that not everything reported by the government and the mainstream media is accurate. But this practice has clearly become more intensely repetitive and disturbing during the COVID-19 pandemic. This is not simply because agency recommendations and government mandates have completely failed to accomplish what was promised while they've lied to cover it up, but because the government and its partners are now openly advocating for censorship of those who expose their shortcomings. Then it says, but this latest study, their most recent attempt to defend their endless mask recommendations, is truly unconscionable. There are so many flaws it's hard to even know where to start, but it's important to debunk this level of purposely misleading garbage because it's being shared by the usual misinformation crowd. So if you read the entire article, you'll see all the problems there are with this study, and then the article finishes with this. This study is absolutely ridiculous and a new low point for the CDC. They've completed their divorce from science, data and evidence and moved exclusively into political advocacy. We've learned over the past few years that they are completely untrustworthy and purposefully misleading to suit their needs, but this is a new level of misinformation even for them. It will, however, achieve the desired purpose. Countless retweets from credentialed political activists and media coverage by those too blinded by ideology to see the devastating flaws. Misinformation is dangerous, and all too often it comes from the CDC. So remember, this is about a study that Michael Baker refers to in this article by Stuff. So exactly as Ian Miller says, it's being shared by the usual misinformation crowd. And if you want to report Michael Baker and Stuff for spreading misinformation, you can go to this website, which is called Fact Aotearoa. FACT stands for Fight Against Conspiracy Theories. So yeah, go there and report Michael Baker and Stuff for spreading this misinformation about masks.
If you were going into an operating theatre and surgeons were operating on you, would you want to wear a mask?
Well, the coronavirus is a respiratory virus, and a surgical mask does not protect you from from a respiratory virus. It's got leaks all around it, and it's really designed as a barrier protection for people in the operating room. That's why they call it a surgical mask.
You, of course, have been a very vocal supporter of mask use. What do you think about dropping these mask mandates?
Well, kia ora, Ingrid. Look, I think when you look at the wording, no one's actually talking about dropping mask mandates. It's actually fine-tuning them. And it's a question of which environments do we need masks in. And they have the huge benefit that they really interrupt transmission very effectively.
We've never recommended masks to mitigate viruses because they don't work. And that's what the science says. The highest level of science that we should be looking to are meta-analysis of multiple randomized controlled trials. So we know that randomized controlled trials are really the only way to make a really sound decision. It's the epitome of the scientific method. We do have those studies in terms of influenza viruses and even measles viruses. And that those meta-analysis, multiple meta-analyses of influenza transmission in healthcare workers and in a healthcare setting have consistently said that masking really has no effect in preventing transmission. A 2015 study on cloth masks said they're absolutely ineffective and should not be recommended.
I'm just getting a bit of practice in case I need one.
Don't wear a cloth mask. Cloth masks are little more than facial decorations.
You always have to assume now that if you're indoors with other people, that one of them might be infected with this virus. They'll be firing out these aerosols that can fill a whole room. And that's why really masks are going to be the key protection we have indoors for the medium term at least.
So I'm putting it to you again, are masks effective in stopping the transmission or at least mitigating the transmission of COVID-19 or the new variants?
Yes.
And most over-the-counter options won't prevent people catching the virus.
They're not very effective.
Are masks effective?
Yes. They're not very effective. After all, the virus can be also infect you via your eyes. It basically likes to land on the mucous membranes, and then from your eyes it could go down into your nose anyway.
Did you ever say masks don't work?
No.
No.
Never. I think people should not bother with face masks. We need to be a mask-wearing society.
We need to be a mask-wearing society. We need to be a mask-wearing society. We need to be a mask-wearing society.
It's an inconvenient truth.
This is a national disaster.
Like climate change.
Blah, 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 blah. How dare you?